Hello. So I am going to start by covering very briefly Chapter 1 in Abnormal Psychology. Just a heads up, in these brief videos, you will find some, not most, but some information from the textbook that I will elaborate on and or maybe give additional examples for to help you learn the material a little bit better, okay? You still need to go and review the PowerPoint slides that are available in Blackboard, as well as read each entire chapter that is assigned in each module, okay? So we're on Chapter 1. It gives a really nice overview of the history of treatment for psychological disorders, but I'd like to focus in this video on how we define or characterize abnormality or mental illness. So the book uses the terms abnormal behavior quite a bit. I will be using the term mental illness more so because it feels more appropriate here. But please be mindful of the fact that when I say mental illness, it's the same as what the book refers to as abnormal behavior. So when you think about making the distinction between the ups and downs of daily living, right? We all go through a lot. We all have moments of tension and anxiety and sadness and all kinds of negative feelings. That's normal, right? But if we want to distinguish that from mental illness, we need to be mindful of what sorts of things mental health providers pay attention to in determining whether a person is presenting with just daily struggles that are perfectly normal, nothing out of the ordinary, versus an actual mental illness or a psychological disorder. So there are 3 Ds to keep in mind, okay? Deviance, dysfunction, and distress. So I'd like to demonstrate these 3 on an example. Let's imagine that a mental health professional is faced with the task of determining whether a child who comes in with a parent has or does not have attention deficit hyperactivity disorder. That is something that will be covered later in the semester, later in the textbook. The child may be hyperactive, impulsive, speak out of turn, forgetful, very easily distractible, right? But how do we tell that this is an actual difference from what we would normally expect in a child of the same age, right? So one of the things we really want to pay attention to, is this what you would expect? Is this normative behavior? Would a child around the same age be expected to behave similarly, to struggle similarly, to have some of the similar challenges in the different departments of their life, right? So that's what deviance stands for. It stands for deviation from the norm, from what is considered to be normal, right? So 5 and 6-year-olds tend to be quite distractible, right? That tends to improve with age, right? So a 9 or 10-year-old would be expected to be able to sit still for an extended period of time, to pay attention, to ask questions, to follow instructions. So that would be one thing that the mental health provider is paying attention to. How much is this behavior deviating from what is normal and expected? Okay, so that's the first D. The second D is dysfunction. Dysfunction basically means that the person would be expected to struggle in some areas of their functioning. Could be one or more. So a child who does have the diagnosis of ADHD very often struggles in school. School can be very challenging because functioning in a setting where the kid needs to be sitting down, following instructions, not getting out of his chair or her chair, and doing all the things that they're expected to do for the duration of the school day, that is something that can be truly challenging for children with ADHD. So the child would very likely have difficulties functioning at school. But that same child may also have difficulties functioning at home, right? Remembering to brush teeth, following instructions if mom or dad or another parent or caregiver says, I need you to do this and that, and the kid immediately forgets what this and that was, that would impair their functioning at home as well. Could be impairment in social functioning, right? Having difficulties with friends because of excessive issues with impulsivity. Okay, so that's the second D, dysfunction. And the third D is distress. Very often, although not always, we do see a good amount of distress in people who have been diagnosed with mental illness or a psychological disorder. Okay, it could be excessive sadness, worry, preoccupation, but it could be also a sense like, I am not good enough, I'm not smart enough. That can come up for children with ADHD because they struggle in school because it's very hard to learn if you're not paying attention or following instructions. They may end up feeling distressed about not being as smart as their peers. Very often that's not the case, but they feel that way and it causes them distress, and that would be a sign that something is not quite right as well. Okay, so we have covered the 3 Ds, right? Distress, dysfunction, and deviance, and that really refers to deviation from the norm. That's it for today. That's all I'm going to cover from chapter 1. Be on the lookout for chapter 2, and I'll see you next time. Bye.